as Nigeria joins the world community to celebrate World HIV/AIDS Day. Practitioners have called on global leaders, policymakers, and all and sundry to champion the cause for the right to health and access to therapeutic and preventive services which are accessible and available. And the chair of the campaign said the only way to bring down the level of HIV is by giving access to free services which include testing, treatment, and other care services. He said awareness and testing is key to the elimination of HIV/AIDS as envisioned by World Health Organization and United Nations programs for HIV/AIDS for 2030.
Take the right path, your health, your right. Why is it very important to take charge of our health? Or why is health our right? This is to call on global leaders, other policymakers, healthcare practitioners, citizens, and everybody to champion the cause for the right to health. All individuals should have access to therapeutic and preventive services that are easily accessible and available. And this can only happen if there's equitable distribution of healthcare resources across board, irrespective of the person's condition or the health status. The only way we can achieve or we can bring down the scourge of HIV is to ensure that everybody has access to free services, including testing, treatment, and other care and services. Now, the goal of HIV is, by the World Health Organization and then the United Nations Program for HIV/AIDS, is to ensure that HIV does not remain a public health threat by 2030. And that is why we are here. We want people to be aware that HIV is still a problem in our environment, and we want people to come to the hospital, to go to healthcare hospitals and other healthcare places where they can seek health, they can seek help, they can test themselves for free, and those that are tested positive can go on treatment and then achieve virological control. We have come a long way. National Hospital has seen more than 10,000 patients over the years. Currently, we have more than 3,500 patients. 95% of these patients have actually achieved virological control. That is, the HIV has been suppressed to the level that it cannot be seen in the blood, but it has not been cured yet. So they still have to take their medications to keep the virus at that level. Nigeria-wise, Nigeria has a prevalence of about 1.5%, 1.9% for women, and about 1.1% for men. Approximately 2 million Nigerians are living with HIV/AIDS, and every year more than 50,000 Nigerians die as a result of HIV/AIDS. This is actually a huge number. How can we bring this down? We have to raise more awareness. We have to involve a lot of people. We have to involve stakeholders. We have to involve citizens. We have to involve the government. There has to be much funds imputed into the HIV program to ensure that these gains we have actually had does not regress. Worldwide, more than 39 million people are living with HIV/AIDS. Every year, more than 630,000 people die of HIV/AIDS worldwide, and approximately about 2 million new infections occur worldwide. So it's still a very big problem locally and internationally. We hope that with this awareness, stakeholders, government officials, healthcare practitioners will continue to be motivated to do what we are doing, and also to increase the resources they are imputed into the HIV system to ensure that we achieve the UNESCO 2030, which is to ensure we reduce the threat of HIV as a public health concern by 2030.
For now, there's no support. It is done every year here. We celebrate our own every year here. You know, the clinic has really done very well in respect to our patients. As my consultant has said, we are having, for this fiscal year, 2025, we started in October this year, we have already achieved 95% suppression rates from our clients. And even for our children's side, we are only lacking about 4 of our children that we are supposed to get to put on track for treatment. We have really done very well. Our patients have really been responding to treatment. They have really been doing well. And we are also advising the public to make themselves available for treatment. Many people are not going for testing. It's only when you go for testing that you can actually know your status or the status of the person that you are relating with. So we advise the public to go for testing. Make sure that you go for testing. And when you find yourself positive, it is not a death sentence. You can also make yourself available for treatment. And once you come, we receive you well, we bear with you, and we also take you along. You walk along with us, and we really give you perfect treatment, more than you can expect. So we are really doing very well in this hospital, and we are thanking God, thanking this management of this hospital for their support. We also thank the Federal Ministry of Health for all their support, and the IHVN, who has also been very committed in supplying the medications that our clients use.